Hello everyone, hope you all are having a nice day. Today we are going to learn about the topic renal calculi. So let's start with the definition. Renal calculi are solid crystalline mineral deposits that form within the kidney due to supersaturation of certain urinary components leading to stone formation. So let's now move on to the etiology or causes. First is dietary and lifestyle factors. Low fluid intake leads to urine concentration and crystal formation. Second is high salt intake. Kidneys need to excrete excess Na plus in urine. Water follows Na plus, so increased urine output initially. Increased water loss over time leads to dehydration. This stimulates the release of ADH hormone, vasopressin. ADH signals the kidneys to reabsorb water from the filtrate back into the bloodstream, reducing the urine output. Continued. This means less water reaches the renal tubules, making urine more concentrated and prone to stone formation. Now we move to the next point, is high protein diet. Increases the uric acid levels and reduces citrate. Citrate plays important role in preventing kidney stones. Urinary tract abnormalities. Urinary stasis due to obstruction or anatomical abnormalities. Then infections. Urease producing bacteria lead to struvite stones. Third, it can be drug induced. Certain medication, example loop diuretics, antacids, acetazolamide and indinavir. Now we move to the pathophysiology. First point, dehydration, high salt intake or high protein intake leads to increased concentration of stone forming substances in urine, calcium oxalate, uric acid, phosphate or cystine. When urine has too many minerals and not enough water, tiny crystals develop. These crystals clump and form a stone. These stones lodge in renal tubules or urinary tract, leading to obstruction and pain. Now we move on to the clinical features. First, severe flank pain. Sudden onset radiates to groin or lower abdomen. Second, hematuria, blood in urine. Third, dysuria, which is painful urination. Fourth, urgency and increased frequency of urine if stone moves from kidney into ureter or bladder and irritates the lining. Fifth is very common, nausea and vomiting. Now we move on to the signs. First is costovertebral angle tenderness, Murphy's punch sign, pain on tapping the angle between 12th rib and spine. Second point, hematuria, detected in urine examination. Now we move on to the investigations and diagnosis. First is urine analysis. This is very important. Normal urine pH is around 6. Urine is slightly acidic. So in urine analysis we will find hematuria. We will find crystals which will suggest us the stone type. Urinary pH. Acidic is less than 5.5. Uric acid or cystine stones. Alkaline is greater than 7.5. Struvite, calcium or phosphate stones. Leukocytes and nitrites if infection is present. Second, serum biochemistry. Serum calcium, uric acid and creatinine to assess the kidney function. X-ray KUB, which is kidney ureter bladder, detects radiopaque stones like calcium oxalate, calcium phosphate and struvite, but it does not detect radiolucent stones, which is uric acid and cystine stones. So we need to do USG KUB, kidney ureter bladder. First line in pregnant women and pediatric patients, as X-ray and CT scan radiations are harmful. This is a very important point. Detects large stones but misses small ureteric stones. Fifth, non-contrast CT KUB, gold standard investigation for detecting all types of stones. Identifies size, location, density of the stones. Sixth, for recurrent stones, 24-hour urine analysis. plus stone analysis. Now we move on to the complications. First is obstruction, urinary retention leading to hydronephrosis and kidney damage. Second is infection, pyelonephritis or urosepsis. Third is CKD due to recurrent stones and renal damage. Fourth is ureteric stricture due to stone-induced scarring. Prognosis: small stones less than 5 mm, 80% pass spontaneously. Medium stones 5 to 10 mm may require medical expulsion therapy. Large stones of greater than 10 mm require intervention, surgery or lithotripsy. Fourth, recurrent stones require long-term preventive measures. Management. First point, increase fluid intake, at least 2.5 to 3 liters per day. Second, limit salt intake. This is very important. Third, limit animal protein. Fourth, avoid high oxalate foods like nuts, chocolates, tea. Fifth, consume citrate-rich fluids, lemon juice, orange juice. This helps prevent calcium and uric acid stones. Thank you. Have a nice day. Keep supporting.